Hello, everyone, and welcome to our first Science on the 7th live stream. We're starting on the International Day of Clean Air and Blue Skies, which brings the attention to air pollution around the world. And today, to talk about air pollution and how it impacts our health, I have here with me Dr. Zorana Anderson, who's at the University of Copenhagen. Welcome, Zorana. Really excited that you're able to join us from Brussels. And right between all of your other meetings today on account of Clean Air Day. So what we're going to do today is over the next 15-20 minutes, talk a little bit about air pollution, what we know about the health effects of air pollution, and why we are really trying to bring attention to this topic. And I'm going to start off with my first question, which is relatively broad, Zarana. So, in the run up to the Clean Air Day and also otherwise, we continue to hear that air pollution is a major public health threat. But how do we really know that? What kind of science has been telling us how air pollution impacts our bodies and our health? Can you tell us a little bit about that?
Yes, Pallavi, thank you for this good question, and thank you for inviting me to participate in the science talks. We're very appropriately today to talk about air pollution from Brussels. So we have a very solid science, and we understand very well how air pollution exposure, which we mainly get by breathing passively every day, we inhale amount of air pollution and gases and particles that come from different sources, from traffic, from industry, from residential heating, from agriculture, and so on. And we know very well from biological studies in cells in animals and from epidemiological studies, that type of studies I work on, that these gases, particles in air can come in our lungs, cause something called inflammation and oxidative stress, which are the key mechanisms. And these injury to our lungs through inflammation and oxidative stress can contribute to decreased lung function in adults, to impaired lung function growth in children, and lead with this effect on a number of chronic respiratory diseases such as asthma, COPD. We also understand that this can contribute to suppressed immune response, and this is how air pollution can increase risk of respiratory infections, which is very relevant right now in midst of COVID-19 pandemic. We also know that these particles can travel through our lungs to our bloodstream and literally reach entire body, all our organs. So now we understand, and research moved from lungs further onto our bodies, to our blood system, to blood vessels, to our heart, to our brain. And we know now the air pollution also via inflammation in our blood vessels it can increase risk of ischemic heart disease, stroke, myocardial infarction. Even new research points out to links with arrhythmia, heart disturbances of heart rhythm, as well as heart failure. Air pollution caused systemic inflammation in our body, and fat tissues are also linked with diabetes. This is something of the latest knowledge we have, and quite disturbing with the diabetes pandemic we have also in the world. And some of the latest knowledge also show impacts on the brain and impact on dementia, possibly also other neurodegenerative diseases such as Parkinson. And also some of the newest knowledge, air pollution may also negatively impact our health, mental health, via this neuroinflammation in our brain, as it does with stroke and dementia and so on. So we have really very solid knowledge that air pollution impacts very many organs in our body. And that's why we talk about air pollution as a public health problem, because of this wide range of diseases that it affects. Air pollution is already a problem before birth. We are exposed in bodies through our mothers, and already we see, unfortunately, in infants even before they're born, impacts on reduced birth weight, on impacts on their lungs before they develop. So these are effects that start really in our early life before we're born, and then throughout lifetime. And this is also why this is a very traumatic exposure. We also, this is a risk factor, unlike lifestyle risk factors we talk about, smoking and alcohol, and how many people smoke or drink too much or exercise too little. Air pollution is such that everybody's exposed. With latest WHO guidelines, which set the lower limits for a number of pollutants, we understand now that literally 99 or close to 100% of world population is exposed to air pollution levels that are harmful to our health.
Yeah, so I think I'm going to stop you for just a second, because I think we have an image to really show those that are joining us what it looks like if we look at air quality around the world, and comparing it with the World Health Organization guidelines. So lots of reds and yellows, which indicate poorer air quality, and greens being relatively better. But Zorana, as you were going through this very long list of different ways in which air pollution impacts our health, recently we've also been hearing that even at very low levels of air pollution, some of those countries that we saw up here relatively green, so I assume the levels are much lower than what we are seeing for regions that are red. How does air pollution impact us at those relatively lower levels, and what do we know about that?
Well, we have earlier known less about air pollution levels and how dangerous they are. And now in the most recent, very comprehensive literature review provided by WHO, most recent WHO guidelines, we have seen that we have many more studies now from low-level exposure areas. These are studies that are mainly coming from Western Europe, from US, where we had successful legislation and we have seen decrease in air pollution levels over the last several decades. These levels of air pollution are below current limit values, both in US, around 12, for example, for PM2.5, 25 in EU. These are still much higher than 5, the recently mentioned WHO guideline, which we know that air pollution is dangerous above. So these newest studies from these areas show us clearly that there are clearly health effects below these current limit values, both in US and EU, and they go all the way down to 5. Actually, even some of the newest studies that have such a even lower exposures, we really don't see lower thresholds. Air pollution is dangerous at all levels. There is no air pollution level that is not dangerous. Similar to smoking, maybe less air pollution is less bad for you, but it's nonetheless bad for you. So this is really changes our perception. We thought maybe that reaching current limit values will protect us, but with new evidence, we clearly see that we're not protected even with current limit values we have in EU or US, and that we need to do much more to reduce air pollution to reach levels that will improve our health.
Yeah. And if I can bring back that image for one more second, I know, we are in September right now and slowly going into winter, when these regions, a lot of the ones that we see in red currently, South Asia, Central Asia, parts of Europe, we are going to be going into the winter season where, as the news headlines tell us every year, air pollution levels go to extremely high levels. So, you just said WHO air quality guideline is 5 micrograms per meter cube for PM2.5, really small, fine particles. But in winter, in some of these locations, especially in parts of Asia, parts of Southeast Europe, we see levels going as high as 300-400 micrograms per meter cube. So, do we have information on what can happen to our health during these really bad air pollution episodes, or times when these levels are way higher than what we know is already bad for us?
Sure, Pallavi. As you saw in this graph, there's a large global variations in air pollution levels in certain regions that are much more exposed than others. But still, even in the green regions and in Europe, we have this variation seasonal, as you mentioned, when we heat up our homes and when it's colder, we drive more our cars. And we have also daily variations in the traffic peaks when we are residing and driving our car or biking close to very heavy roads. So, of course, these are annual averages that we see on these maps, but daily we're exposed or in hourly, sometimes minutes, to very high levels and peaks. And we know that these are very bad for our health. This is a different one mechanism is that the low level exposure during our lifetime will increase. If we have a low-grade inflammation in our lungs every day, this will increase risk that we develop chronic lung disease or chronic heart disease or so on. But also we know from different type of studies that being exposed to these peaks in air pollution, maybe for a few hours or several days, if you have really high air pollution in the cities, as we've seen in Asia, also in Eastern Europe, they can really affect our health and trigger sudden myocardial infarctions, strokes, hospital admissions or symptoms from respiratory chronic diseases, need for medication, and unfortunately also they can also trigger a death in chronic respiratory or cardiovascular patients. And we have seen even in London that this is really a real thing, that air pollution can trigger death in a case of a very young girl who was a very heavy asthmatic who died from air pollution episode in London.
Yeah, I'm going to come back to, that case actually, because often we know that scientists and experts tell us that air pollution has a variety of health effects, like you said, right from childhood till our old age, even in the womb, we can get exposed to air pollution. But one of the questions that a lot of people ask is, how do we really know that air pollution is the cause of death? Because we never see it on a death certificate. And this is a question, that's come up in so many conversations in different places. But as you just mentioned, in London a few years ago, a young girl by the name of Ella Roberta, I know we have an image of her here, died unfortunately due to a fatal asthma attack. And it took several years for doctors to really figure out what role air pollution played in it. So I'm hoping, Zorana, you can talk a little bit more about it, and also talk about how air pollution can really impact children. Because one of the positive things in some way from this very, very tragic accident has been that Ella's mother, Rosamond, whose image we also just saw, has become this very strong vocal champion for clean air around the world, in the UK, where Ella lived for a few years. So can you tell us a little bit more about, both this relationship between asthma and air pollution, and also why we don't see air pollution as a cause of death, but we know that it is really causing millions of deaths around the world?
Of course, we have seen this in our data. We have no doubt, well, us that work with epidemiology, that in areas with high levels of air pollution, you see more people develop asthma, both children and elderly, and other diseases. And also talking about these daily and seasonal variations on the days with high levels of air pollution, we clearly see in our data more hospitalizations, more deaths, more use of medication from these chronic diseases. So we have no doubt. But of course, the classic argument was, well, show me one death certificate where this is so. And, it could be smoking or exercise when it's chronic, complex chronic diseases such as cardiovascular diseases, chronic obstructive pulmonary diseases, where smoking and our diet plays a role in elderly. It can be difficult to say what is exactly the reason for this. So case like this, and what is really touching about Ella's case, 9-year-old girl, and as her mother points out in a very touching video that I'll encourage you to see on the website, in the event of Rosamund, Ella's mother, getting an award recently for European Lung Foundation for her work, is that this girl was born healthy and developed asthma at age 7, with no apparent genetic or other risk factors other than living on a busy street in London with NO2 levels above EU limit values. And then this girl develops a very severe, very difficult asthma that is hard to treat, ends up coming to emergency room hospital over 30 times, often in winter when air pollution is high, and tragically ends up dying as doctors cannot treat this. And as Ella's mother points, which really makes me think that nobody in that process, no doctor, no nurse, no public health official, has ever mentioned air pollution, that this could play a role. So this ruling showing that it is really air pollution that caused her death has really been linked that she had no other apparent risk factors, but she lived on this busy road, and emergency room visits were mainly in days and in winter with high air pollution, is really important, because ruling also says that the lack of information to mother and also to clinicians who didn't know about this is also indirect cause of death, because perhaps one could have prevented some of these or understand better what happens. Another important part of this ruling is that lack of London City to comply with NO2 legal limit values is also cause of death. NO2 is way too high from limit values, which is dangerous for health. So this is a very important case that it's not surprise to us scientists, but to put a face on this tragic association that we know of a child that apparently has no other risk factors to develop such a severe disease. It's very easy to understand, and why should a young child develop such a severe disease by the place of their residence? I think this has a very important message in communicating about health effects of air pollution that are here. They happen even in cities in Western Europe where air pollution is high, and that we really need to do something about it. In other complex diseases in elderly, it could be more difficult to say is it air pollution or smoking. But clearly, I was just at a medical conference with, for example, asthmatic patients or chronic obstructive patients or cardiovascular patients that they have no other risk factors, that perhaps comply to healthy lifestyle, but maybe live close to busy roads, or maybe use coal or wood burning in their home for heating related to maybe poverty, or work in industry, live close to industrial sites. If doctors assess exposure to air pollution, and if that is considerable, and lack of other risk factors, one could conclude, and one should be more using this inquiry with patients to see whether air pollution really indeed can cause that, or cause development of disease or worsening of disease. It's also important for that to help patients with existing diseases.
I mean, thank you so much for going through this, and of course, this is a very tragic story. But the hopeful thing in the story is, as I said, Rosamond has really come out as this really vocal champion for clean air. A lot of doctors are getting engaged in the conversation around air pollution in different parts of the world. There are groups of doctors that are, starting to talk about air pollution as an issue. And also, you are repeatedly sort of talking about how air pollution is linked with a lot of non-communicable diseases. And I just want to pull up a quick graphic about the health impacts globally on different diseases. So we see here a whole host of diseases: diabetes, this is type 2 diabetes, COPD, respiratory disease, a chronic respiratory disease. We see lung cancer, stroke, and also lower respiratory infections, which often tend to be common in children, as well as deaths in infants and children before the age of 1. So there is this huge range of diseases on where we are seeing the impacts of air pollution. And one thing that is also very striking is that in different parts of the world, these patterns can be very different. And of course, we start talking about air pollution, the first couple of places that come to our mind are India, China, maybe South Asia. But there are other regions around the world, as some of our work has shown, as other people's work is also showing, where pollution levels can be very high. And I know you grew up in Serbia and lived there summer, winter, all year long. And the Western, Southeastern Europe and the Western Balkan region in particular tends to be a place of really high pollution. So I wanted to understand from you also a little bit, what's really driving these differences in pollution across Europe? Because often the first thing people will think is, oh, Europe, cleaner than parts of Asia, cleaner than parts of Africa. But as this figure that we're just pulling up here will show, there are really hotspots of air pollution in Southeastern Europe and in the Western Balkan countries in particular. So can you tell us a little bit more about what's going on here and why we should be paying attention to the air pollution problem in this region as well?
Yes, Pallavi, as you mentioned very well, and as we see in these global maps, of course, there are areas of the world that we have classically talked a lot about, in China and India, with most extreme levels with population density that's huge, and focus has been on these areas. Also, Africa is coming with increasing interest, and we probably have underappreciated that we have parts of Europe that also have really shockingly high levels of air pollution and still very dirty sources. And Balkan countries and Serbia, where I grew up, is one of them. So we really have two sides of Europe, Western Europe, where we have seen decline in air pollution and adaptation of the policies towards more cleaner energy and production of energy, transportation of transport system towards more electric cars now. They have worked, while Eastern European countries, Southeastern Europe, Balkans, Poland, Slovakia, Czech Republic, very closely tied to socioeconomic situation. These are countries from Eastern Bloc that are still lagging behind in socioeconomic levels. And these are the main reasons why these countries are still experiencing much higher level air pollution, mainly due to old energy systems. Still, energy production is heavily dependent on coal, so as we see in Serbia, as we see in Poland. We all see much older traffic car parks. We see very little electric cars, if any, if you visit Serbia or Bulgaria. We see also one of the main reasons is also underappreciated reason, residential heating and cooking with coal, with wood. there's energy poverty is a real issue in these parts of Europe, where we still have big poverty issues and socioeconomic inequalities, and groups that have no other means of heating or cooking, but still using coal, wood, and even other much dirtier sources, as old tires, even old newspapers, and so on. Also, waste management, burning of the waste dumps has been. We've seen some episodes in Belgrade related to that. So these are issues really related to socioeconomic situation here. Also, lack of political will and to focus on their environment and create solutions, as Western countries have been able to do. So we see now even some European cities, even some Balkan cities. Belgrade has had episodes and reached top 10 most polluted cities, close to Indian and Chinese cities. So these are real acute problems, and Europe will really have to address this if EU is going to meet their Green Deal ambitious plans to be climate neutral and accomplish zero pollution. So we'll see increasing interest in this area, and I think we need to speed up helping with some solutions there as well.
Yeah, absolutely. We would certainly hope that this, some level of increased focus with more data and more information will make some of this engagement easier. We're still sort of dealing with the COVID-19 pandemic, and I know we've sort of gone through a big list of topics so far. But as we get towards the close, with the pandemic, the one lesson that we have learned is that public health messaging is really important. It needs to be clear, it needs to be informative, and it needs to be based on credible information. So, as an expert in this topic of air pollution and health, what would be the top 2 or 3 messages that you would like our listeners to go away with today?
So related to COVID-19 pandemic, I think the response to COVID-19 pandemic has shown us that we can really achieve a lot of dramatic changes in our exposure, in our way of living, even closing down entire societies. We couldn't have imagined that if we have a solid reason to do that and we communicate to public while we're doing it. Some of the side effects of lockdowns, people have seen serious dramatic reductions in air pollution, which have opened our eyes and probably triggered our imagination to see that we could have cities with much cleaner air and less traffic and more people walking around and quieter cities, and that this is achievable. Of course, lockdowns are not a way to do that, but we are able to impose and with good political will make changes that seem difficult and impossible if you have a good reason to do so. Air pollution kills more people a year than COVID-19 does, but it's an invisible killer. It's something that we haven't been able to communicate so clearly about and raise it as an acute issue. COVID-19 link with air pollution has given us a platform perhaps to raise more awareness of air pollution impact of COVID-19. We're seeing really high quality research coming out to show that air pollution increases risk of severe COVID-19, perhaps even of infection of COVID-19. And bring us back from this focus on chronic diseases, also on air pollution, very significant impact of immune systems throughout lifetime, via which air pollution increases risk of pneumonias in children and adults alike throughout a lifetime. And pneumonia is still a significant cause of that, as well as COVID-19. So this gives us a new platform to remind one more time public, our politicians, why regulating air pollution is important. This is another way to find pandemic, and we will see more of these. And third message, I think pandemic also showed us this inseparable link between us and our environment and our climate and our own planet, and that we have to tackle air pollution problem together with climate change, with planetary health. COVID-19 and this transmission of viruses from animals to humans that we're concerned is indirectly related to loss of biodiversity, to the way we produce animals for food, and we see that we are very much interlinked to the way we move around the world, the way we impact our environment, and the solutions have to be that we have to take better care of environment and take actions to reduce air pollution in the center of those decisions, both to improve environment and air quality, which will improve our health right away. We know that any reduction in air pollution will significantly improve our health, but also this is a way to deal with climate change. We have same sources of fossil fuels in the center of that, and by improving health of our planet, will improve our health in the center of that.
Yeah, well, Thank you so much, Zorana, for spending a few minutes with us today and talking about air pollution and health. And thanks a lot for joining us from Brussels. And for all of your listeners, thank you again for joining us on the Clean Air Day today. We will continue this series, so join us next on October 7th and then also in November and December, where we will continue to talk about some of the most important air pollution and health related questions. In October, we will be joined by Dr. Susan Annenberg and other guests to talk about air pollution in cities where we live. And in the meantime, if you have any questions for us, please feel free to tag us and send those questions via social media or email us. And all of this live streams will also be available on our YouTube and social media channels. So stay tuned, stay safe, and let's all work towards cleaner air. Thank you very much.